So I welcome you all in today's session. In today's topic, we will be covering brachial plexus. It is one of the most important topic that is frequently asked in university exams, mainly in 15 marks. So it is very important topic. Without wasting time, let me tell you today what we will be learning today. Surface location, anatomy, and its clinical manifestation we will be doing in next video. So stay tuned with me for better topic understanding. Firstly, telling you what does the brachial plexus mean. Brachial means related to arm. Related to arm. Brachial plexus. Brachial mean related to arm. Anything related to arm. Plexus means network. Here network is network of nerves. So by understanding the what does the name means, it makes the topic very easy to understand what we are trying to learn. So the brachial means related to arm, plexus means network. Here network is network of nerves. Let me show you right here. This one is this is the skeleton of human, and these are the spinal nerves which forms the network of which forms the plexus called brachial plexus. You can see right here. What I am trying to do is to make you feel the topic. This one. This is the diagram taken from B.D. Chaurasia, Indian author. Here is the brachial plexus network of nerves. Definitely, when you would be dissecting the cadaver, it won't be visible to you like this, but in such a fashion. Now going to another part of the video. Covering the anatomy of brachial plexus, it is formed by ventral rami of C5 to C8 and T1 segment of spinal cord. What does it means is right here. This one is the spinal cord. You can see right here is the spinal cord, and these are the spinal nerves emerging out of the spinal cord. So these yellow nerves, these nerves form the brachial plexus network of nerves. You can see right here, this one is C4, this would be C5, C6. This forms our brachial plexus, these nerves. Now here it is ventral primary rami. What does it mean is, you know, when we dissect the spinal cord, here it is dorsal root, and here it is ventral root. They both combine together here and again divide into ventral rami and dorsal rami. So brachial plexus is formed by this ventral rami. Can you see this ventral rami? Brachial plexus is formed by this ventral rami. So if the teacher says you dorsal rami forms the brachial plexus, then you would say no ma'am, it is false. Ventral rami forms the brachial plexus. Brachial plexus is formed by C5 to T8 and T1 segment of spinal cord. Right here you can see again this one. This is C5, C6, C7, C8 and T1. Can you see? C5, C6, C7, C8, T1. These spinal nerves form the brachial plexus. Telling you the location of the brachial plexus, surface location, because it is very important for knowing the surface location, because when I covered my first year, there were many students who don't even know the surface location of brachial plexus. They even say the sacral plexus or lumbar plexus. So it lies here, right here, specifically saying in the neck region, behind the clavicle and in the axilla. These are the path of brachial plexus. Roots are present in neck, divisions are present in behind the clavicle, and chords and branches are in axilla. Going to the anatomy of the brachial plexus. Occasional contribution of C4 and T2 segment. When C4 and T2 segments are involved, C4 primarily C5, C6, C7, C8 and T1 are involved in formation of brachial plexus. But when C4 or T2 is involved, when C4 is involved, it is called prefixed, and when T2 is involved, it is called postfixed. Right here, very simple. And this was all general about the brachial plexus. Now we would be learning how plexus is anatomically divided. Plexus is anatomically divided into 5 parts: roots, trunk, division, chords and branches. Say it with me: root, trunk, divisions, chords and branches. There is a simple mnemonic to learn all these. Raju Taylor drink cold beer. Root, trunk, division, chord, branches. Right, that was I was saying. Here, roots are root value of the spinal nerve. This is C5, C6, C7, C8 and T1. This is the root. When the root combines, they form trunk. You can see here, right here, trunk. Root combine, C5, C6 combine to form trunk. And trunk, this trunk is called upper trunk. C7 continues to form middle trunk. C8 and T1 combine to form lower trunk. As simple as that. Now trunk. Trunk divides into ventral part and dorsal part. Each trunk divides into ventral part and dorsal part. This division of ventral and dorsal division is certainly in, or what should I say, these trunks divide into ventral and dorsal divisions. This one is ventral, dorsal, ventral, dorsal, ventral, dorsal. Now, when these divisions combine, see, when ventral division combine, it forms chord. Ventral combine to form chord. Divisions combine to form chords, and chord further gives it branches. Revising it once again: root are the root value of spinal nerve C5, C6, C7, C8, T1. You all must remember that root values of brachial plexus are C5 to C8 and T1. C5, what is C5? Here is cervical spinal nerve, C5. This roots combine to form trunk, and trunk give origin to division. Division then combine to form chords and then to branches. Here it seems to be very sophisticated, very clumsy type. So I have another way to make you understand the topic. It would surely be yes. It will be there. It will surely be asked in your exams. So there is a simpler way to make you understand the topic. Now start drawing with me. Root, trunk, as I said earlier, Raju Taylor, trunks, divisions, cord, and branches. So what are our roots? C5, C6, C7, C8 and T1. These are our roots. Just extend them. And what was the second part? They combine to form trunk. This one is our trunk. C7 continues. C8 and T1 combine to form trunk. Right here. Till here, is it clear? Now trunk divided into two. As I said earlier, ventral and dorsal. Ventral, by straight line we would be showing ventral, and by dashed line we would be showing dorsal. So this one is the ventral division and this one is dorsal division. Every trunk divided into two: ventral division, dorsal division, ventral division, dorsal division. Continue this. This is our division. Now these divided again combine to form chord. Let me show you how. So this ventral part of upper trunk, here I should name them upper trunk, middle trunk and lower trunk. So ventral part of upper trunk and ventral part of middle trunk combine together. See, right here they are combining. They combine together to form chord, and this chord is called lateral chord, LC. We will denote it by LC. And this ventral part of lower trunk combines, it does not combine, it actually continues forward as it is. So it forms medial chord. Here it is lateral, here it is medial chord. And all three dorsal divisions combine together. All three dorsal divisions combine together and forms posterior chord. Here lateral chord, posterior chord and medial chord, these are arrived from in the relation with second part of axillary artery. This, the axillary artery which is behind the pectoralis minor is the second part of axillary artery. You can see here in relation to axillary artery, these chords are named. The one which is lateral to the axillary artery is our lateral chord. One which is medial to our axillary artery, here it is medial chord, and one which is behind the axillary artery, second part of axillary artery, is posterior chord. So you must know that these names are on behalf of with relation to second part of axillary artery. Now here the most important part comes, the branches. So the teachers aren't interested in all this stuff, they are interested in branches. I'll tell you first. Here it is LML. This is the shorter way to learn the branches. LUNAR, lunar, M4U, M4, 4 times M and U. These are the mnemonics, you can easily learn them. So the branches of lateral chord is LML, posterior chord lunar, LUNAR, medial chord is M4U. Here LML corresponds for lateral pectoral nerve. Lateral pectoral nerve. M for musculocutaneous nerve. Cutaneous nerve. L for lateral root of median nerve. As the name suggests, this applies to pectoral muscle, musculocutaneous nerve, lateral root of median nerve. Here L is for lower subscapular muscle. Lower subscapular nerve, it supplies to subscapular muscle. U for upper subscapular nerve. N for nerve to latissimus dorsi. A for axillary nerve. R for radial nerve. So these are very easy to learn. See, L stands for lateral pectoral nerve. Pectoral supplies to pectoral muscle. Musculocutaneous nerve, muscle and skin. Median nerve. You can check out my another video for median nerve. Lateral root of median nerve. Lower subscapular muscle. Upper subscapular nerve. Nerve to latissimus dorsi. Very easy. Latissimus dorsi is a muscle. Axillary nerve and radial nerve. Coming to next, medial chord. Here M stands for medial pectoral nerve. NV. I am denoting NV as nerve as NV. And next time for medial, MEDIAL, medial root of median nerve. Medial root of median nerve. Right. Here it was lateral root of median nerve, medial root of median nerve. M is for medial cutaneous nerve of arm. It supplies the arm, medial cutaneous nerve of arm. This M for medial cutaneous nerve of forearm. And U is for ulnar nerve, ULNA, ulnar nerve. So this is the simplified way of drawing a brachial plexus. By this method, you would surely be scoring more than 12 to 13 marks in your university exam if asked for 15 marks. Revising from, so today we did the surface location, root, trunk, surface location, we did root, trunk, division, chord, branch, overall anatomy, and in next video we will be doing clinical relation. Again, revising brachial plexus, brachial related to arm network of nerve. Here it is, anatomy formed by ventral rami, ventral primary rami of C5 to C8 and T1 segment of spinal cord, occasional contribution of C4 and T2 segment, C4 when called prefix, T2 postfix. Plexus is anatomically divided into 5 parts: root, trunk, division, chord, branches. Raju Taylor, drink cold beer. Root, trunk, division, chord. C5, here it is C5, C6 and C7. They gives another branch. This branch is called long thoracic nerve. This one is upper trunk, middle trunk, lower trunk, all the divisions of trunk. This one is lateral cord, this is posterior cord, this is medial cord. So you must remember these cords are named in relation to second part of axillary artery. These are the branches. Mnemonics are LML, lunar, M4U, lateral pectoral nerve, musculocutaneous nerve, lateral root of median nerve, lower subscapular nerve, upper subscapular nerve, nerve to latissimus dorsi, axillary nerve, radial nerve, medial pectoral nerve, medial root of median nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, and ulnar nerve. Hope you find my video a bit helpful for you all.